Welcome to the Curitics Connect podcast, brought to you by Curitics Health. This podcast is your go-to listen for insights into value-based care, healthcare technology, and the innovations driving better patient outcomes. Each episode will break down complex industry challenges, highlight emerging trends, and speak with experts leading the shift towards the next generation of value-based care delivery programs.
Hey everyone, welcome back to the second episode of Curitics Connects, where we take you behind the scenes with the people shaping the future of value-based care.
We're your hosts. I'm Ryan.
And I'm Danielle. So today's episode is a special one. We're sitting down with someone who helped actually build and co-founded Curitics from the ground up.
Yes, he's our chief product officer and a friend. At this point, we've worked together so many times. One of the co-founders of Curitics. Please welcome to the show, Chris Pempsell.
Yeah, it's
Hey,
a pleasure to
Chris.
be here with you guys.
Yeah, absolutely, man. Happy to have you.
We're glad to have you. We were peppering a little bit of this on our last podcast about the fact, hey, next time we get to get Chris and we get to introduce you a little bit to him. During today, the goal is we're going to chat a little bit about Chris's background, hopefully give you a little behind the scenes of who Chris is, what led him to co-found Curitics, and really how his product vision continues to guide where we're headed and what's new as we continue to grow Curitics.
Yeah, absolutely. Chris, can we start off with a little bit of background? What were you doing before Curitics? I know we know that, but I think our listeners would love to know.
Sure, absolutely. So I sort of started my career as, I'll call it kind of a payer systems integration specialist. I was working with two Blue Cross licensees, Capital Blue Cross in Pennsylvania, and then later did some work with Blue Cross of North Carolina. I realized that if you want to do innovative work in the value-based care space, working with large payers is probably not the best test bed to do that. So after that, I spent really the last 10 years of my career prior to forming Curitics, just working as kind of a serial consultant, working with all sorts of organizations, managed care organizations, but also just, I'll call them like healthcare innovation companies, building things like propensity models, building products from the ground up. Had a very large set of experience building solutions on top of the Salesforce Health Cloud platform. I know that's where I met some of you guys doing some of that work as well, and various other platforms, BPMs, EMR integration type initiatives, really just aiming at solving interoperability challenges that are really required in order to better orchestrate value-based care workflows.
Awesome. So Chris, did you always see yourself stepping into a founder role, or is this something that evolved over time with your experience?
I don't think that anyone ultimately decides one day, oh, I'm going to go found something. But I think a lot of people decide one day, there's a problem that I want to solve. And I think that sentiment would be shared amongst many folks in similar situations who've created entities. I didn't intend to found a company. I intended to solve problems that I felt were very challenging in my past roles in working across various organizations. I felt like it was a bit of Groundhog Day, right? You
Yes.
go into organization ABC and you solve the same problems that you did at organization XYZ. Instead of doing it over and over again, I wanted to do it once and hopefully with a little bit of a different perspective on it.
That's great. Did anybody early on in your career kind of influence you or influence your career path and kind of you see drove you in this direction, or was it more just your experiences?
I would say that if we don't credit who we come from, we're not doing any type of justice. I feel very, very fortunate in my career that I've run across some wonderful mentors, wonderful executive coaches that I think have really shaped not only how I look at business, but also how I look at the problems that are impacting healthcare and healthcare delivery today. It would be a long list, Ryan, if I was to name names, but some
Fair
of them
enough.
you know, some of them you haven't. But there's been, I think, a really strong sense of guidership that's enabled me to get to where I am today, and just a lot of wonderful folks in my network to have learned from, and folks that I'm still learning from today. You never stop learning. Healthcare, I think, as you both know, is just it's a very deep iceberg, and the more folks that you talk to, the more that you understand their challenges, the further they're down in the water you can, so to speak, go and identify some interesting solutions along the way.
Yeah, I think your feedback along the way, just in my career too, has been definitely of guidance. So I know that you've gotten some along the way because you've shared that wisdom with myself as well. We also share a unique, I think, love of the product space in terms of like what we do on a day-to-day basis working together. What drew you to product just early on in your career in terms of going from there's what I see at least on product development is there's two different brains there in a lot of ways. There's your development side, and then there's the product side, and one is more visionary and one is more doer. And I would love to hear your perspective on that.
Well, I'll just maybe kind of start with my educational background there. So I didn't study computer science initially. I studied graphic arts and fine arts. So that's my original background before I got into all of this crazy healthcare technology. What I've learned over the last decade though is that a combination of creativity plus practicality. And when I say practicality, the ability to build something from the ground up and the ability to understand how all of those small, finer parts work is a really powerful combo because you can see the macro and the micro at that point. Without the macro, you solve nothing, right? That's why there's so many folks out there that want to build something. They have all the skill sets. They have worked for these crazy companies, FANG type companies, Google, Apple, Microsoft, but they're working for those companies because they can't think through what are those really kind of macro problems that they want to just delve themselves into, right? I think, at least for me personally, that ability to kind of go back maybe to my arts background and say, like, hey, this is conceptually how I want this to work. I don't know all of the inner workings or how to get this done at this point, but I think that's helped me move myself into a position where I can then kind of creatively problem solve how to then figure out all of the nuances and all of those downstream problems that require answers in order to build kind of that macro level vision.
It takes a creative brain, truly,
Sure
to
it
be
does.
able to innovate to the degree that you need to in technology. And I think at times people forget that there's that side of it, you know. So I think we get the benefit of your creative genius.
People have to like the products that we're building, and I think that's something that is very, very, very important, at least from my perspective, in terms of product development, is you have to look at the user. And a lot of healthcare technology is really not that usable. It's not that great to look at. It's not visually appealing. It's not designed with UX in mind. It's not designed with aesthetics in mind. And at least what I've learned in my career from building solutions outside of Curitics at past organizations as well is, when you give someone an experience, something that's very well thought out, there's a higher gravitas to actually using it, right? And that's something that I know we try to do in our day-to-days at Curitics is not only solve problems, but design them in well-designed, user-centric ways. Something that hopefully is continuing to help us grow as an organization here.
Yeah,
Well,
absolutely.
Chris, I think that's a perfect segue into diving into the origin of Curitics. And I would love to get from your perspective, where did the idea come from? How did we even get Curitics started? And why, did you decide, hey, let's co-found this company?
Well, and it never was that moment that said like, "Hey, we're just going to go found something." It really started from a perspective of saying, we keep doing the same thing over and over and over again. Why isn't this working, and why does this take so long? So, I mean, just to kind of sort of break it down, right? You go into organization A. Let's just say that they're a small health plan, and they're working with Medicare populations. They're working with C-SNP lives. You go into another similar health plan. They're working with similar populations, but they have an entirely different model of care. And those nuances really require solutions that have a great deal of flexibility embedded into them. I'm not here to say that there's not those solutions in the market. I've worked with many of those solutions in the past. I've worked a lot with Salesforce as a platform. It's a great platform for a lot of organizations. I come to this with literally decades of experience of building technology on top of that platform. But it's not the right fit for every organization. And I really believe that the vision of value-based care, right, can be achieved with the ability to innovate, right? And a lot of these platforms, through rather high licensing costs or high PMPM costs, those, in my opinion, are contributing to the administrative burden that we see in healthcare today. With Curitics, what we wanted to do is we wanted to say, hey, you need to execute a healthcare workflow that's going to drive improved care outcomes. It's going to reduce cost. How do you do that, right? You need one platform. You don't need 10. And that was really kind of a foundational, kind of a key thesis for the build of Curitics, is saying, how can we reduce these this really the high reliance on point systems to address various aspects of a workflow. And I mean, I'll give you one example, right? Everyone needs to engage members. Now, how is that done? That's done via calls, that's done via text, that's done via email, that's done via fax. Yes, fax still in 2025.
Crazy.
There's a lot of paperwork that is required to go out to be in compliance with these workflows, right? There's a need to then talk with various systems, whether those are claim systems and EMRs. In my past experience, you build all of these pipes by piping data between different vendors. The end result of this is you've achieved your goal, maybe not exactly as where you started from, because it might not be the most usable system in the world, but you've achieved the workflow by integrating these systems, but in an 8 to 12 month time frame, if you're lucky, and with a pretty significant vendor expense that you'll need to manage and kind of continue to deal with and negotiate on as your organization scales. What we wanted to do here at Curitics is say, hey, is there a better way of doing this? Can we put more control back into the hands of operation leaders, put more control back into CMOs that are responsible for ultimately building out the model of care that is innovative to their organization? How can we enable and empower that user base to be more involved in technology, right? To shape the technology roadmap and to give them tools where they don't need to be an engineer. They don't need to know how to code in 3 languages in order to execute their vision around reducing the cost of care or improving care outcomes. So that's really where Curitics came from. And then over, let's just call that's the first 18 months of the organization, what we did is we built out really a low code platform with 2 focus areas: medical cost management and risk adjustment, with that inherent flexibility in mind, right? Where an average user, someone who's not technical, can learn the software in a couple hours. They can come in, they can build clinical assets, they can start stringing together their workflow and deliver something that previously would require an engineering team, a systems integration team, a couple different vendors to achieve. So really simplicity, that's where it came from. As we worked with pilot customers in the beginning and as the organization grew, that was really the trigger point of saying, hey, we're doing something that's pretty powerful here. There might be a sense of founding a company around it, but that's not where Curitics came from. It really came from saying, hey, we've done this in the past. It's always been a problem. It shouldn't cost nearly as much, and it shouldn't be nearly as complicated. How can we make it easier, faster, and cheaper?
Would you say that aha moment was like the spark for you in terms of like the customers are coming, you're seeing this build, and you can have this now, this vision, if you will, of, oh, we could actually build something special here that can serve the masses.
Exactly. And you know how ideas start too when you're young, and especially when you're trying to bootstrap something and you're not raising capital and doing all the stuff that a lot of startup founders do. You're just trying to make decisions to build something that solves those problems, right? And at some point you have to come back and you do a lot of rework. But I would say really the aha moment was when we started not only getting that growth, but getting the interest and also having end users saying, this is working. And through analytics, being able to see like, this is faster. We're generating ROI for our customers. We're reducing the time of these workflows taking place significantly and sometimes over 50%. And also, we're implementing these solutions pretty fast. Like this is something that we can stand up. This is something that we can scale. That really was the aha moment, Ryan.
Right. Makes
So,
sense.
I think with the startup world, everybody kind of hears the rumor about like they can be tough, right? And especially when you are bootstrapping an organization. But also when to hear you talk, it's like we've come a long way in 3 years. We've done a lot of great things. We've produced value. But if you were to pull the curtain back a little bit and self-assess, like where were those messy moments of Curitics that you would say that allowed us to really learn and launch us to the next step? Where's the moments where y'all had to come and be scrappy together, right? To make sure we were
There's a lot of
moving
those
forward.
moments, Danielle. You know that, and there's still many more of those to come. I think
Yeah.
that's ultimately how you learn is by understanding challenges and then working together as a team to overcome them. And then when you do overcome them, kind of looking at that from retrospect and saying, how can we improve this going forward? I'll say in the beginning is I think many startups do. It's just trying, hey, how can you build a product fast? How can you build a product lean? You do create tech debt when you do that. It's something that you have to come back and you have to really evaluate. Not only is it the right time to solve that tech debt, what's the right tech debt to solve, because you do create a lot of it in the process. But those are things that I think ultimately all startups face. Like what's more important sometimes than making the best decision is making a decision and testing it, right? And I think that's something that we do fairly well at Curitics is, hey, we'll go build something out, we'll put it in front of a customer, we get real world feedback, we understand what's working and what's not, and then we iterate, and I think our ability and our speed at really executing that iteration for our customers is what's enabled us to get to where we are today, even with all of the fancy stuff that I think maybe more kind of well-funded VC, PE funded back companies have at their advantage. I think we've been able to do that in kind of a bootstrap capacity, and in some ways are better off for it because we've learned a lot. It also kind of forces us to really kind of hone in on what are the right problems to solve, and are we getting the right feedback? You can't make a mistake. You can't make a mistake. You have to listen, you have to hear, and you have to react. And you need to make sure that you're empowering the right outcomes for your customers.
And just real quick too, before I know Ryan will add the next question, but I think what we've also been able to do is understand that we're not going to always be perfect and take the ownership of, okay, this may be not the right approach, or is it resonating right in the marketplace? How do we pivot? And I think as a team, one of our secret sauce areas is that we aren't afraid to pivot, right? We don't get ourselves stuck in the mud and not able to listen to what needs to change. And I think what I know I have learned as a leader is it's okay to come into the room and say, hey, I don't know if this is the perfect way, right? Let's test it. Let's get feedback, not only from our team members, but from the market. And if it's not working, let's pivot and go in this way and make this work. And I think overall, that's been a little bit of a powerhouse of Curitics is we take that in and make the changes when it makes sense.
And also working with the right team of advisors. I mean, I'll take credit where credit is due, but I'll also credit those who have really helped shape our roadmap. And I think we've had some awesome advisors along the way. You can work in healthcare for 100 years, you're never going to know everything, and getting folks that are experts in the field and really hearing and listening to their vision, their input. I think that's also been really powerful for us in terms of shaping our roadmap.
It's my last question for you before we take a short break here. Before you're a new father, so I'm gonna make this a little bit personal for you. And in terms of a startup, when in my time here, and this is the second one I've been a part of, it has always felt like because you're essentially giving birth to this idea, if you will, right? That there's some symbiosis, if you will, to raising a child as well, right? You're trying to engage and do the right things and give the right feedback and usher a child in the right direction, but you're learning yourself at the same time. Would you say that now that you're a father yourself, would you agree with that sentiment?
I would say sometimes I have two children. I don't think
Uh,
that's not fair to my daughter, but
yes.
it's certainly I think a good juxtaposition, Ryan. You have to learn along the way, and I think you also have to be humble and say what you don't know. If you don't listen, if you don't follow the market, and also where your customers are leading you, you're not raising the right child.
There you go. You don't know what you don't know,
Yeah.
right? Yeah. We learn a lot more even from what we're trying to raise than we are giving sometimes. So, well, that's excellent. That's excellent. Thank you for that feedback.
All right, guys. So we're going to take a short break. We'll catch you back after we take that.
Awesome.
All
Thank you.
right. Thank you.
All right. Welcome back, everyone. So now we're going to jump into the rapid fire round, Chris. So with this, we'd like to just throw some quick questions coming from different ways, maybe work related, maybe a little personal. We'll shoot over some questions and then you can hit us back with some of those answers quickly without a lot of time to really think through
All right,
what you're
let's
going
do
to
it.
say. Okay.
Awesome. All right, Chris, I got the first one for you. A little earlier, you alluded to what Curitics was and how it started. What was the earliest version of the product in terms of the vision, and then how has it evolved since? But going back to what we were talking about previously, in terms of what we've learned thus far from the market and how that shaped where we're going.
the product's come a long way in 3 years. I mean, where we started from, there was no front end. So originally, Curitics was built out purely to serve as an interoperability layer, right? Our goal was to use this as kind of the common ground to bridge the gap between a number of different systems, primarily looking at scheduling systems, EMRs, some of the existing care management and medical cost management solutions in the space. That vision quickly shifted, and shifting this more into a true kind of BPM, kind of orchestration layer for those workflows. And as we've continued to evolve the product, I mean, we have multiple products now built on top of that same low code engine. We have a very interesting, kind of cool solution for the risk adjustment space. It's a provider portal, but it's very actionable, really enables providers to execute HEDIS and gap closure workflows, as well as things like annual wellness visit, which just enables that improved data capture while also maintaining discrete data elements, which we can use in analytics, SDOH initiatives, things that really bring meaningful color to populations. And then separately, of course, we have a care management product that makes use of that same underlying technology stack, but really facilitates a totally separate set of workflows. So that wasn't the vision where we started from. We were purely focused on interoperability, but it's been an interesting journey to see where our customers have led us, and as I was saying earlier, our advisors as well.
Yeah, absolutely. Well, in that same vein, in terms of where we're going as an organization, and also where the industry's going, right? I think we have both a shared healthy love for AI and what that can do and how it can make us more efficient, as not only as an organization but just as individuals. How do you see that impacting the product roadmap moving forward for Curitics?
I think AI is going to be huge for us, Ryan. And you know me, I'm always tinkering with something related to AI for either Curitics or solving some of our business and operational challenges. How do we make that better? But I really believe that that AI is it's here to stay, and it's going to serve a really pivotal role in healthcare. Where I see AI really kind of helping us, right, is we have this bedrock configuration layer that is, I'll call it, a bit time tested at this point. We know it's working for our customers. We know we can build products successfully on top of it. But we also, at this point, we know what our customers are doing on our software, and we know where there's points of manual effort, where there's points of manual work that they're doing. AI, I think, can really kind of come in and help us accelerate some of the work that our customers are doing on the platform, primarily through agentification. Agentification is something that I'm really, really excited about. Now, I want to be very careful in what I'm about to say with this. This is not to replace, right, the work that our customers, our care managers, our nurse practitioners are doing on the platform. You can't ever replace sound medical judgment. But a lot of where I see kind of agentification and AI coming in is being able to augment the work that they're doing, where they become much more of kind of a reviewer, right? We're able to save them time. We're able to save them really kind of this manual effort and refocus them back onto the full licensure of their job, where they can look at a broader population. They have more information at their disposal. And some of these manual processes that they're doing today, AI is just working through that on the back end for them. So our roadmap is deeply AI focused. I'm super excited how that's going to play out over the course of this year and how that's going to benefit our customers as well.
Absolutely. Yeah, me too.
Spot
Thank
on.
you.
All right, well, shifting gears a little bit, Chris, outside of just Curitics and the product, I'd love to know a little bit about Chris and what's your why? What keeps you motivated every day to keep showing up at this crazy chaos of an organization we can be sometimes just because we're doing so much so quickly? What keeps you motivated?
Oh, I don't know. Startups are fun. I mean, yes, it is chaotic at times,
Fun.
and I think we can all agree on that. But I guess kind of what keeps me coming back is there's never a shortage of problems to solve. I'm not someone, I think, who would do well in a big corporate. I like working on multiple things. I like wearing multiple hats. I like hearing what our customers have to say, whether it's positive or negative, and trying to think through how does this impact our roadmap and how can we build a better product for it. So, I mean, it might be chaotic at times. I'm sure it is chaotic at times, but I don't think there's any startup that's not. If you
Absolutely.
don't have the chaos, I would question what you're doing, to be honest.
Absolutely. And you don't have the bureaucracy either, Chris. I mean, we get to make our decisions and run with them, right? And I think that's another element to add to what you're saying there in terms of the corporate environment. Neither one of us would thrive there. I don't think all three of us, for that matter, because of that. So,
Exactly. Exactly.
Allows us
Exactly.
to be agile.
right.
Well, Chris, so if you were not here helping us build Curitics, what would you be doing? What would your day look like?
I'd probably be building something else.
I agree with you.
At the end of the day, I like building. I like building, but I like the ideas we're working on. So I'm here to stay. Danielle.
Awesome.
We're
Thanks
glad
for
to have you,
sharing that.
Chris.
Yes, we are very fortunate. All right. Well, looking ahead, guys, I think, as we kind of talked about where we came from, where Chris came from, and how things were started and how we moved into what makes up Curitics today. If we were going to look ahead, where do you see Curitics in the next year or two, Chris?
I hope we keep growing. I mean, at the end of the day, that's important for any company. I'm really excited for our growth. I'm excited for some of the organizations that we're working with. But I will say, and kind of echoing back, Ryan, to your question earlier, I'm really excited for our roadmap, particularly this year. The level of maturity of AI solutions is, I think, hitting this point where it'll start impacting our lives in a positive way, And for healthcare, particularly, that is being able to put more viewpoints in front of a provider so that they can make more accurate decisions, right? It's about reducing some of the administrative burden that has driven healthcare costs to where they are today. I'm excited to be working on those problems today and really integrating that into our roadmap in a substantial way, where let's call it a couple months, let's call it a year from now, our customers are benefiting from the efficiency plays that ultimately AI is going to help us achieve.
Absolutely.
Absolutely.
I think there's another element there, Chris, that I'd love to hear your perspective on too, in terms of your excitement, and that's the interoperability. I feel like that's a place in addition to AI that is really accelerating tremendously, and a huge issue in the market in general in terms of being able to share data. So, do you have, from a roadmap perspective, is there anything exciting coming down the pipeline you could share around that?
I guess, kind of what I'm excited about from an interoperability perspective is that it's easier than it was 10 years ago. So 10 years ago, I spent a lot of time working with platforms like Mirth and Rosetta. And I know, Ryan, you kind of come from that background too. They're not the easiest platforms in the world to work with. You're parsing through these HL7 messages and ultimately trying to figure out how do you string this data in the right workflow or the right format where it's actually usable. Just from a broader ecosystem perspective, that interoperability technology between healthcare systems, I think, has really evolved over the last, particularly 3 to 5 years. Looking at like Fire R5 and what we're able to achieve versus pure HL7. I'm looking at all of some of these kind of like middleware players that are now in the space where you can actually put data directly in front of the provider within their EMR, which of course we all know providers adoption's a challenge with anything that's not the EMR, right? So I think that the technology framework, right, that exists in the market today is going to be a huge accelerator for what we're able to do, because it wasn't there 10 years ago.
Absolutely.
Those options didn't exist. You were putting a PDF back into the integrations tab in your EMR that the provider never saw. What we can do now is as soon as you open up that chart, we can put the full care plan in front of the provider, so
Game
they know what the
changer.
care management team is doing. They know what the health plan is doing. They know what data is available from all of these different partners, where it's really putting that data at the fingertips of the provider where they expect it. And I mean, Curitics, obviously, we're working with a number of different integration partners. We've built integrations with many EMRs today, but I'm very excited to continue leveraging some of this technology that it just wasn't there even 5 years ago, to drive better collaboration among care teams and to hopefully yield better care outcomes.
Absolutely. I think that's music to my ears, and I think it would be to any provider that gets a hold of this podcast as well. I have an uncle who's a primary care provider who is part of an ACO in the Philadelphia area, and that is his number one concern always, is that he cannot see what is being done to his patients outside of his practice, outside of his EMR. We often talk about this and postulate how can we come up with something, right? How can we come up with a solution? And to hear that that's on Curitics roadmap, it's I think that's going to really change what is able to be done in this market. So glad to hear that.
Yeah. Lots more to come on that in future episodes. I think we'll be able to dive into it a lot more and talk directly about what we're specifically doing here at Curitics to help solve that problem. But for today, I think this was great. Chris, thanks for joining us. I know you'll be on future podcasts that we're doing as we talk about additional topics that are market could be interested in learning about. But thank you for your time today. Thanks for being a great leader here at Curitics and just being part of our crazy team. It's great to have you.
Thanks for having me. Always a pleasure talking to you guys, and look
Absolutely.
forward to being on again.
Absolutely. And before we
Absolutely.
go, Chris, can you share with our listeners today how they can connect with you directly or with Curitics?
Absolutely. So, Christopher Pempsell, look me up on LinkedIn. Would love to hear from you. CuriticsHealth.com, that's our website. You can learn about the whole platform that we're building out and deploying here at Curitics. Would love to meet some of the listeners here.
Awesome.
Awesome. All right, guys. Well, that's it for today's episode of Curitics Connects. Make sure, though, you have to subscribe to Curitics Connects on Spotify, Apple Podcasts, or wherever you listen to podcasts. Also, if you have a specific topic that you would love for us to cover, feel free, send us a message. You can email, go through LinkedIn, directly through the podcast LinkedIn. Anyway, that's the best way to kind of channel to provide us that feedback. We would love to know what you want to hear. So thanks for being with us today. Thanks for listening.
Yeah, absolutely. And we'll catch you next time. We're going to have another great guest, Umesh Srivastava, another one of our co-founders. So, Chris, thank you again for your time, and we'll catch you all next time.
All right. Thank you both.
Bye-bye.
Bye, guys.
To learn more about Curitics Health, please visit curiticshealth.com. This podcast is for educational purposes only and is provided with the understanding that it does not constitute medical, legal, or financial advice or services.